Hi, my beautiful viewers and subscribers. I wanted to talk about something with you guys. You might have noticed that I don't appear on camera. That's because, as a practicing Muslim, I choose to stay off-screen in line with my religious values. But lately, I've noticed something concerning. Many channels discussing men's health and sexuality are using AI avatars and getting millions of views. But often, the information they share lacks medical accuracy and can even be harmful. And I'm not getting much views. Despite of working so hard, and after doing a lot of research, and then my content gets reviewed by my peers, then we decide to upload this after doing some necessary amendments so that you get the authentic and genuine information. Because our profession is to take care of you and your health, and we value you a lot. Keeping this in mind, we've decided to use an AI avatar as well, not as a gimmick, but as a tool to help bring genuine science-backed medical information to more people, while still honoring my religious boundaries. I may not show my face, but what I do show is integrity, professionalism, and trust. My commitment is to you, and to giving you accurate and respectful information on men's health based on real science and clinical insight. I personally thank each one of you. Your presence means a lot to us. So in short, if you're looking for medically sound, respectful, and honest advice, you're in the right place. Let's move towards today's topic. Okay, so when night falls, most people expect peace, stillness, and uninterrupted sleep. But for many men, that expectation is shattered by an all too common frustration. Frequent nighttime trips to the bathroom. Instead of getting the rest your body needs, you're woken up again and again with an urgent need to urinate. If this sounds familiar, you're not alone. And more importantly, you're not helpless. As a medical doctor specializing in urology, I want to guide you through a professional, practical approach to understanding and managing this issue. And I promise you, sometimes it doesn't take expensive tests or machines. What it takes is awareness, simple tracking methods, and a better understanding of your body's signals. So grab a pen and paper. We're going to get to the root of this problem, step by step. Let's start with the basics. Drinking water and fluids throughout the day is essential for kidney health, blood circulation, and metabolic processes. But too much fluid intake, especially near bedtime, can lead to disrupted sleep. Your body continues filtering fluids at night, and the bladder does what it's designed to do: fill up and signal when it's time to empty. Some patients are under the impression that more fluid is always better, that constant hydration is the key to wellness. But that's not always true. Excess fluid intake in the evening often leads to repeated awakenings during the night just to urinate. This disturbance not only affects your energy levels the next day, but over time, it can contribute to more serious health concerns due to poor sleep quality. This is where the real work begins, and where you play a critical role. The most important diagnostic tool you have right now? A notepad. I encourage all of my patients to track their fluid intake and urine output over 3 consecutive days and nights. Here's what you do. Every time you drink something, write down the exact time and volume. Water, tea, coffee, everything counts. Then, do the same each time you urinate. Record the time, and ideally collect and measure the volume of your urine. There are measuring cups for this you can get at any pharmacy or online store. After 3 full days, you'll have enough data to assess several key patterns. How much do you drink in 24 hours? How much urine do you produce in 24 hours? What time of day do you consume the most fluids? How much urine is being produced during the night? Are you producing large volumes per bathroom visit, or just a little, frequently? Here's why this matters. Normal urination volumes per void are around 300 to 400 milliliters, or 10 to 13 US ounces. If you're voiding significantly more than this multiple times during the night, and your fluid intake is heavy in the evening, then yes, reducing evening fluid intake might resolve your issue. But only if that pattern is clear in your notes. More importantly, you should always aim for your urine to be a light yellow color. It's the best and simplest indicator that your fluid balance is appropriate. Now before we move on, there's one more important self-check I want you to try. Press your thumb firmly into the skin over your ankle, hold it for a few seconds, then release. If the skin stays indented, that is, if it leaves a lasting mark, this could indicate fluid retention in your lower extremities, a condition called peripheral edema. It may be harmless and related to simple vein concerns like chronic venous insufficiency, or it may signal more serious issues like heart dysfunction, kidney problems, or even liver disease. Whatever the cause, here's the critical connection. When you lay flat at night, that retained fluid redistributes throughout the body, and your kidneys begin filtering it rapidly, leading to increased nighttime urine production. This is why it's not just about how much you're drinking. It's about how fluids are being stored and processed in your body throughout the day, and how gravity plays a role. But what if you track your fluids and the numbers don't add up? Suppose you're not drinking much in the evening, yet you're still waking up multiple times to urinate and only passing small amounts each time. In that case, it's time to consult a urologist. You may be dealing with incomplete bladder emptying, a silent condition many men don't even realize they have. And no, you often won't feel like you're retaining urine. The only reliable way to identify it is through post-void residual measurement, usually done via ultrasound in a clinical setting. There may also be underlying bladder irritation, which increases urinary urgency regardless of volume. Common causes include urinary tract infections, chronic bladder inflammation, or an enlarged prostate, particularly in men over the age of 50. But interestingly, the issue isn't always purely urological. One key medical condition we often overlook, especially in men, is obstructive sleep apnea. This sleep disorder, often characterized by loud snoring, breathing interruptions, and frequent nighttime awakenings, leads to repeated drops in oxygen levels during sleep. What does that have to do with urination? Well, the body compensates by releasing more atrial natriuretic peptide, ANP, a hormone that signals the kidneys to produce more urine. This hormonal response is completely unrelated to fluid intake, yet it causes nighttime urination frequently linked to sleep apnea, and that's just the beginning. Factors like sleep positioning, vagal nerve stimulation, even behaviors like nighttime teeth grinding, bruxism, may all play a role. So, in our journey through the night, across rural landscapes, self-tests, data logs, and inner awareness, what have we discovered? That urological health at night isn't one-dimensional. It's a blend of physiology, environment, aging, habits, and sometimes deeper medical conditions. My goal isn't just to help you stop going to the bathroom at night. It's to help you understand why your body behaves the way it does, and how to take control of the factors within your power. So if you're ready to take charge of your health, keep tracking, stay curious, ask the right questions, and when in doubt, speak with a qualified urologist. I'll continue this series with deeper dives into what your body's doing while you sleep. If this helped spark clarity or curiosity, subscribe and share. Thank you for watching.